question of infection. So your infection is the condition that results when the microorganisms injure the host. So your colonization is the condition that results when the microbes are present, but the host is without signs or symptoms of the infection. So you're still infectious, but you don't know yet, which is with a lot of things. A lot of times before you actually show symptoms, you're spreading whatever you have. This should be, this is in your book, so it's probably on your book on your computer. I would know this whole table here. If you want to write a little note. So it's the course. So you're going to have your incubation, your prodromal, your acute, and then your resolution stage. So I would know each one of those stages. If you have the book, I have listed here, it's page 477. So your incubation, it is infectious agent, reproduces, but there are no recognizable symptoms yet, like we just kind of talked about. Then the prodromal is the initial symptoms. So now you're starting to not really feel good, you're getting a temperature, so you're starting to realize, okay, I'm sick. Then your acute stage is when it becomes kind of severe. So now you're like full blown, you know, it's a day into it, you are coughing, sneezing, you know, you're running fever. And then your resolution stage is when your symptoms start to subside and you overcome whatever infectious agent that you have. Okay? Kind of makes sense? So just kind of be aware of what each stage is for your test. So the stages of the infectious disease process can be different because it depends on the disease. So for example, a common cold incubation period is 2 to 4 days, where HIV, we talked about, it could be months or years before you start to show any signs of having that virus. So just keep that in mind that each one kind of has a different course. I think we talked about this a little bit last week, but your standard precautions, what's another name that you may hear for standard precautions? No, that's gonna be your universal precautions. So universal would be how you would treat any patient. Also in the hospital, your HIV patient, your Hep C patient, is going to be treated with universal precautions. You don't treat them any differently than you would treat anybody else.
The standard precautions, isn't it just like your mask, hand washing?
Mm-hmm. And gloves, like whatever you're doing. Yeah. Prior to COVID, it would not be a mask. It would just be your hand washing and then gloves if you're having any contact. Eventually, we'll get back to that point, but.
You think? I don't think.
I think so. I don't know when, but
6
I
years
think we'll
from
get
now.
back there.
Right.
This year, maybe? We're still
So
thinking.
that's your universal. And the reason why, so it's always good, obviously, to know if your patient has HIV or Hep C. Sometimes you're maybe a little bit more aware than if you're getting anything with measles or anything like that. But those are the people that you know have HIV and Hep C. There's so many patients that you take care of that have no idea. So just keep that in mind. But you would just use universal precautions for them. There's no extra cleaning. So now maybe if there was like blood that got on the floor or something like that, I would probably use a bleach wipe versus just like a purple wipe or something. But all right, so transmission-based precautions. So we kind of talked about this a little bit. Your airborne, your contact. So you're going to hear it just referred to as isolation. So you may just hear your patient's on isolation, and you'll have to look at the chart and find out. Okay, so what kind? Is it enteric? Is it isolate? Or is it contact? Is it airborne? But you'll hear it just addressed as isolation. Okay. So know this slide for your test. You need to know it about the particles and stuff, because it's the whole point of why you use that N95. Is because those masks are made to keep out those teeny tiny little particles where those regular hospital masks can't do that. You get fit tested for these masks. Who's been fit tested?
We're just giving them,
What?
we're just giving them that drug.
Yeah, so,
Here's a
yeah.
box of it and five for one.
So, yeah, technically you are supposed to be fit tested for them. You put one of the N95s on, they put this big hood, it looks like a beehive one that you would wear if you were gonna go with bees to me. They have this stupid paragraph that you have to read about, I think it's something about rainbows and the leprechaun. Yeah, and then there's a little hole in the middle, and it's generally some sort of like a sweet taste, and they do a couple pumps in the mask.
It's not sweet.
No, it's not, it's nasty.
It-
It's bitter.
Well, I think it
Gross.
just depends.
It
Mine
gets
always
stuck.
say sweet, but maybe.
It gets stuck in
Maybe
like
my
the back of
taste
your
buds
throat
are
when you
all-
breathe it
Maybe
in.
you're bitter.
Mine was always sweet. It tasted like the fake sugar.
Yeah, I was gonna say mine's always been sweet, but I don't know. So they do that, and you're testing to see if you are smelling that or tasting that, if it's getting in your mask. So if that mask isn't fitting appropriately, then they would switch you to a different size, or they have ones that are kind of like beaks that you can use too. So I'm just telling you that's how it should be done. Now during COVID, was that always obviously how it was done? No, but you are supposed to be fitted for N95s. You can't have facial hair and wear an N95, so you would have to shave that. Anytime you lose 10 pounds or you gain 10 pounds, you are technically supposed to be refitted for those masks. Because the shape of your face changes with gaining and losing weight, so they wanna make sure that you have that proper seal, so.
Them guys at the break point, they didn't want to give up their facial hair, so they were like, you can try it, but you can always tell, cause they'd be like in the bus, on the backside, just, coughing, and they're like, you gotta get a shave. They come out looking like a naked bull, cause they didn't have like the real tools. They'd be mad.
Yeah, so they do, I don't know what the mask is. They have some that you can use, or they have like a beard cover or something, but I don't think any of them are as good as those N95s that you can use. I mean, they're not gonna be as.
So we had to be fit tested for like those, and then like the full face, and
Mhm.
like, those like ridiculous,
Yeah. So, anyway, so this slide, like I said, just make sure you kind of know, all the stuff on here. And we talked about a lot of it. This is what that N95 looks like. There's lots of different brands too of N95, so. I wanna say this is generally the kind that you see at the hospital, but again, if they're in short demand, they may look different. So this is your droplet, kind of went along with that airborne that they were talking about, so that's anything that would be passed by coughing, sneezing, talking, if you were gonna suction a patient or something. So you just have to wear those masks down there, it's just those hospital masks, okay? Again, I would know this slide, like how far away should you be from people, to prevent getting it, and how it's passed. Another one you'll need to know too, you'll need to know all of your different precautions. So your contact, can be direct or indirect, like they kind of talked about, that it can be skin to skin, it can be somebody that's colonized with it, and then, is around someone that's maybe immunocompromised for whatever reason and passes it to them, so. if you were in like a C. diff room and you were gonna come in contact with like, stepping in feces or something, you would wanna wear those shoe covers so that you don't get it on the bottom of your shoe, and then you bring it into another patient's room.
We had, a man come in, and he was only here for a week, but he had C. diff, and he would not let any of us for 2 days straight come in there. He would scream, cuss us out, like try to hit us and everything. And he was pooping all over his bed with C. diff. It was everywhere in his room. He was like, we had like no idea what to do, because we've never had anybody act like that. Like, he would not let nobody in there. He was like embarrassed. Like, it was like over the top crazy. Every time we walked in there for like 48 hours, he was like trying to beat us up, everything. It was like, I don't even, like, and we can't restrain him, so like, there's literally nothing we could do besides either get beat up, but like, at the same time, he had C. diff, so as he's beating us up, like, that poop could have been slinging everywhere, like, it was gross.
Yeah, you don't have to change them if you're, like, unless you have like orders in there or something, right? Is there a
To an extent,
Yeah.
to an extent,
It's certain,
yeah, there's,
I don't know how it is at nursing homes and stuff like that, how that all works, but like in the hospital, I mean,
Like, we're just gonna have to get beat up, cause you,
yeah, you don't really run into that too much where they're like refusing to let you clean them up, or if they are, you kinda just do it anyway.
yeah, 'cause they have a right to say no, but.
you also have a job to clean
Yeah,
up.
I thought
They
you
don't
don't
have
have
the
doctor's
right to
orders
say
though,
no,
say
but
like, they can't refuse that or something.
No, I don't know necessarily that you'd have to have a doctor's order that they can't refuse it, but,
Since it's not like safe for them or whatever.
I mean, I think you just do it, and
Yeah.
you would just.
try to educate them while you're doing it.
Yeah, I mean, you always definitely try and educate them beforehand, because ultimately, the hospital's gonna be liable if that person sits in that poop for days and gets a bed sore, they're gonna be liable for that bed sore, and they're gonna have to pay for everything to heal that bed sore, so they don't want that liability. So ultimately, it's gonna come down to the patient's either gonna
That
let
was
you do
just
it,
the scariest thing I've ever been through.
Yeah,
Oh my gosh,
you feel like-
opening his door every day, oh my gosh, cause it was like multiple times, and,
Yeah.
I worked in psych for too long.
If you don't have this, I would highly recommend it. Have work shoes and have home shoes.
Yes.
And those
Yeah.
work shoes do not come in your home. Your animals can get C. diff, so if they lick your shoes that are out in the garage and it has C. diff on it, they can get C. diff. And then you can get C. diff from your dog, and yes, I've heard of that happening plenty of times.
I was gonna say, I saw the saddest thing, a lady's, child got MRSA because she took her work shoes home, and like, the man had like MRSA in his urine and a whole bunch of stuff, and
Mhm.
rightly sliding and all that kind of stuff all day, and she went home and her baby was like playing with the shoes, like,
Mhm.
she looked, I mean, it wasn't like on purpose, they were at the door, and she looked up one day and the little girl like literally was just like, what do babies do, what you say, put everything in their mouth, I
Yeah.
just know she was just, it was just the most distraught, and again,
My mom,
bad way to learn,
my
but.
mom's always yelling, keep it in the garage door closed, I got my shoes in there.
Mm-hmm. Yeah, there's so much that gets on them, so definitely. Another thing too, which, you know, we never did this, but it kind of makes sense to me, is some people did, and I'm like, that makes sense, changing clothes before you come
Yes.
home and stuff. Now, I don't know why it's not something that everybody does, and the more like I thought about it as I was a nurse longer, I'm like, well, that makes sense, because God
Yeah.
knows what's on me. And then you're going home. Now, I did always make it a rule, like, I would not touch my children until I came in and took my clothes off and everything. But the more I think about it, it makes sense to honestly just bring new clothes to work and change. So I know there were some older nurses that would wear like street clothes, come change into their scrubs, and then they would change back to their
Some
street
people,
clothes when they leave.
use the lockers down in like the ground floor,
Mhm.
in the bathroom down on the ground floor.
Yeah,
I know a lot of people who
Oh,
don't put their
I saw
shoes
it.
in the phone, so.
yeah. Well, just keep it in mind, like, when you're thinking about it, cause you don't wanna bring it home. I mean, obviously your kids are like the ones that you're like, God, they're sick now, you know, like, and it's something that maybe you brought home to them, you would feel horrible, so.
There's a paramedic in Hannibal, he literally has a work car, and his kids are not allowed in the work car.
Really?
Because he doesn't want to bring home.
Stuff to them, yeah, I don't blame them. But it's nastier and nastier. So that's just an example of like your C. diff spores that would be in the gut. So your SARS and your chickenpox, we kind of talked about that, with the airborne and the direct contact precautions are implemented, and then, sometimes too, like we said, with, depending on what the SARS is, so like the COVID one, a lot of times they were just like the regular mask. And then, well, I guess it depends. They did N95s if they had them, if not, then they used regular masks, so, but generally. All right. Everybody know the answer to this? Precautions that are used to reduce pathogen transmission from close contact, usually 3 feet or less. Yep. Droplet. Okay. This next one is in your book too. It is, well, I know you don't have the book, but it's page 480. So when you're going through, on your computer, if you wanna mark page 480, it just kind of breaks down each one of them for you. Alright, so your patient has MRSA, which means they need to be on what type of precaution? Contact. So the PPE that you need to wear going in there would be what? Yep, gowns and gloves. Also, another thing, we highly try to have family comply with that. Obviously, you cannot force them to put on a gown and gloves, but most of the time, the family's gonna stop at the door because there's gonna be a sign and stuff, and they're gonna be like, looking around, kinda like, what do I do? So that's a good time to go up and educate them. You have to kind of make sure you're watching what you're saying, because you don't wanna tell them too much information, because maybe that's not that person's power of attorney, or they don't want them to know what's going on or something. So you have to kind of be selective, or, you know, kind of watch how you say it. But, you can just inform them, you know, hey, we are doing special precautions for your loved one. We just need you to wear a gown and gloves when you go into the patient's room. If they question you more about it, you can just say, you know, you can talk to your family about it, but this is what we're recommending right now when you enter that room. And then when you leave, wash your hands, take everything off before you come out. Then if the family, or if the patient's fine with you explaining more to the family, you can, but I kind of put it back on them to explain it. I'm not gonna go in great detail what they have and what's going on and stuff, because that's not my place unless they're okay with it, all because of HIPAA, so. All right, so your patient also has TB, they need to be on what?
Airborne.
And then the PPE that you're gonna need for this, so N95 and what else?
Gloves and gown.
Gloves and gown too. All right. So it says when you take off your mask, do you do it inside or outside of the room? Obviously, pre-COVID.
Outside.
So for your N95s, yeah, you would take them out, or take them off outside the room. Make sure that door is closed behind you. Their door should always remain closed. Any droplet, again, should remain closed. I mean, really all of them should, but the contact, maybe you could kind of leave it open. Sometimes the patients like to watch people in the hallway, and I think because they're bored, so.
Or just scream for the nurse.
That's true. One of the groups kind of talked about this, so about patient placement. What do you normally try and do for anybody on isolation?
Put them in the same room with someone.
By themselves or with somebody with the same illness.
Correct. So you would not put somebody on enteric precautions with somebody who's on neutropenic precautions. But if they both have MRSA, they both can be in the same room. I would say nowadays, the only place you'll see room sharing for the most part is gonna be in your nursing homes. Most hospitals now are private rooms. There's maybe a couple that, and especially like maybe during COVID, they double roomed them, but generally now most of the hospitals are private room, so.
Is it the same precautions or the same illness?
It would be the same, well, they would have to be the same precautions and same illness.
Okay.
I mean, I wouldn't think, cause then you could, if somebody had like VRE and the other one had MRSA, it would be the same precautions, but two different things, so then you could potentially give that to,
Right.
you know, and vice versa. These are just some pictures, I'm sure you guys saw all of these when you were looking up your stuff. If you ever have a question, just refer to those on what you're supposed to wear or what's going on or something, so. This we've already kind of talked about, your PPE. Talked about taking off your PPE and stuff, we're gonna go back there here shortly and, just practice that real quick. Other thing is double bagging, so infection control measures in which one bag of contaminated items such as trash or laundry is placed into another. So if the outside of the bag got something on it, so if you're in a seated room and you're doing a bath and you threw the washcloth and it didn't quite make it in and there's like now stool on the outside of the bag, you would wanna double bag that because now there's a risk of somebody else touching that and passing that. So you would potentially then wanna go ahead and double bag it, have somebody, you know, hold a bag open and then you can put it down in there. Okay? This is just them doing that now. We talked about this. CDEP always has to have bleach, and then methods of discarding biodegradable trash. So that's your paper, body fluids. So your urine, you can obviously flush that down the toilet. So when you empty your urine bags, you flush that down the toilet. But, so let's say you're taking out that fully, as long as there's not tons of urine in that bag, when you take the fully out, that can go in the regular trash. Okay, it doesn't have to go in a red bag. So same thing like with like an NG. If you're taking the NG out, it can go in the regular trash. It doesn't have to go in a red bag. Those red bags are really, not the bags themselves, but the weight of the stuff in them is really expensive for the hospitals to get rid of, so they don't want you to put things in there that don't need to be like burned or whatever. So they're really big on making sure that you're putting the right things in the right containers. A lot of them have black boxes now, so sometimes you'll put, depending on what medication is in there, you'll put it into a black box, or you'll squirt the medication in there, whatever's left over, and then you can discard the needle in the trash, because a lot of them now are,
Safety.
yeah, no, they're plastic.
Yeah, like I know what you're talking about.
Yes, so you can, just throw those in the trash because they're not sharp where they will like stick you. I'm trying to think what they're called. Blunt, like they're like blunt needles and stuff. So we'll look at them more and we'll see them, but you'll just get rid of the, whatever it is, and then you'll just throw it in the trash then. Cause a lot of the syringes now just Luralock, you know what I mean when I say Luralock, to the IV set. So on, the IV, there's like a little connector and the syringes will just screw on there. So you're not, most of the time you don't actually need the needle that's on the syringe to give anything. You can if you need to, but most of the time you just are gonna twist it on there and you give it that way. You're not actually having to use the needle. The only time you're really doing that is if you're gonna get like an injection or something. So you don't need those a lot.
What about those needles that like, once you get done, like, you send the needle back inside
finishing point.
the safety ones. You would put those in like the red box, the biohazard. So that would be, anything that is saturated with blood would go into a red bag or a red container.
Okay, I have a weird question. Okay, so like if you, cause I only did this at one place and I got the containers.
Excuse me.
But when we had urine in the suction containers from the like pop-out catheters, I don't know the building before, you know what I'm talking about?
Yeah, Miss V likes to call them the coochie canoe.
Yeah. Like, we had to put this powder in it to melt it up,
Mm-hmm.
and that would prevent that, but like how come like all the places don't do that?
Good question.
Because when I worked at SSO, we could just
You know, I don't know why,
okay.
when we did colonoscopies, we did the same thing, like the suction that we were sucking out, we had this special like crystals that we dumped in to it and it solidified all the stuff and then we were able, then we put it in a red bag and it got discarded. But we didn't do that for a long time prior to that. So I don't know why some things change and some hospitals do it one way or another. I'm assuming maybe it's like they got dinged on it or something with JCO before and this was their solution.